Morning, Jenna. Well, Senate Democratic leader Harry Reid recently made clear what conservatives have long suspected, that he and other Democrats, including the president and key officials, see Obamacare as a stepping stone to single-payer, government-controlled health care. Listen.
Don't think we didn't have a tremendous number of people who wanted a single-payer system.
So why didn't it happen?
Well, you know, you have to get a majority of the votes. We weren't able to do that.
I'm all for a single-payer system. Eventually. I think what we have to do, though, is work with what we've got to close the gap.
Now, President Obama also said back in 2003 that he favored single payer, but said he knew he might not be able to get there immediately. So what do people mean when they use the term single payer? Listen.
What they really mean is putting everybody into one big government insurance program, and almost always on the left they're talking about Medicare.
But Medicare is tens of trillions of dollars in the hole, so many argue that's not the way to go. Analysts note that single-payer systems in other countries hold down costs by rationing care. Listen.
If you look to, say, Great Britain, there's about 115,000 people there today who have been waiting longer than 18 weeks for admission to the hospitals. In Canada, the waiting list to get in to see a physician of your choice can be as many as 800,000 people at any one time.
The typical wait for a normal procedure in Canada is 4 months. For a hip replacement or a knee replacement, the wait is 10 months. Some people are waiting more than a year for a knee replacement.
So nations that have tried single-payer systems have to ration care to hold down the cost. Now, the Supreme Court of Canada even ruled that some people died because they were on a waiting list and could not get care. Those may be some of the reasons, Jenna, that those pushing a single-payer system have been unable to round up the votes to put it into law.